So there were a couple of really interesting abstracts and talks, both yesterday and today. Many of them were on metabolism, which is really an important factor. But people so far are concentrating on the cell intrinsic metabolism, and OXPHOS is playing a role, and other factors. And it's interesting the way the metabolism in leukemia cells differs so much from the normal hematopoietic stem cells. And I think we can expect a lot more to happen on that front. But the other studies I really enjoyed are these large-scale, I'll call them omics studies, with which we can analyze patients. And for instance, there was a study by our colleague Tiong from Singapore, who analyzed why some people respond well to tyrosine kinase inhibitor, others don't, and others even relapse very quickly. And it seems like he might have discovered some predisposing factors that lead to a worse outcome versus a better outcome. So I found those very interesting, as well as others on leukemic stem cell biology, new treatments, especially combination treatments. Mike Deininger had a very interesting story on a new combination of two drugs that changes the structure and therefore increases the sensitivity to ponatinib. Those were fascinating talks. And then there were two other talks that I would like to mention as well, because they were fascinating. One of them was focused on the flux of calcium and the inhibition of calcium flux through the calcium channels in chronic myeloid leukemia, and how that changes the cell intrinsic metabolism. I thought that was very good, from Vigne Helgeson's lab in Glasgow. And then secondly, there was a talk on the fact that you can sort of predict by the degree of BCR-ABL positivity in cells who might have, again, a favorable outcome or not. And it seems like if you separate the cells in somebody who's on a tyrosine kinase inhibitor, and you look at BCR-ABL expression in granulocytes versus T cells versus B cells, you can actually sort of predict who might have a better outcome, and therefore, adapt your treatment or decide whether you can discontinue treatment. I thought that was fascinating as well.